Separating the fact from the fiction when it comes to COVID-19. It's what we try to do when we have Dr. Ruth Berggren from the Long School of Medicine at UT Health San Antonio join us, as she is joining us now live. Dr. Berggren, thank you so much for your time. A lot of the things that I want to talk about today have been kind of resurfacing because of a lot of the debates that are taking place at school boards across San Antonio, across South Texas, across the country. One of them that I've heard, one of the arguments is that masks are not effective or only about 50% effective. And if you touch something and then touch your mask, it is ruined. Your answer to that?
So masks are really helpful. And of course, they're not 100% effective. But let me give you an analogy that's very, very helpful. When you get in your car and you go somewhere, you're going to do two things to maximize your safety in that car. You're going to wear a seatbelt and you're going to mind the speed limit. And you know full well that doing both of those things doesn't hand you a guarantee that you won't get in an accident or that you won't be harmed or that you won't get killed. But you know those things work because they improve your odds and they improve your safety. Well, we have things that are like seatbelts and observing speed limits, and it's wearing that mask and it's getting vaccinated. And you need to do both of those things to maximize your odds of a good outcome and staying healthy. As far as how effective the masks are, that depends on a lot of things. Are you wearing it correctly? Are you wearing it over your mouth and nose? Do you have a nicely tight-fitting mask up around the sides of your face, or is there a big gap? Are you wearing it consistently, or are you taking it off to eat and drink and play sports when you're around a lot of other people? All of those things will affect how effective the mask is. But the longer you can spend with your mask properly fitted, the better odds you have that you're going to have fewer respiratory particles invading your airways and potentially infecting you.
We've been at this for 18 months now. Is there anything that you know about that indicates there is a physical harm from wearing a mask?
No, absolutely not. In fact, we have some studies in at least one peer-reviewed journal that looked at this specifically, and there is no evidence of harm from masking, not at all. And so there's a lot of misinformation that is circulating on TikTok and Twitter and so forth, and it's just simply not corroborated by scientifically published literature.
All right, I want to get to one of the next ones, and it has to do with natural immunities. We can build up natural immunities to COVID, and we aren't going to get very sick anyway, so we should just get it and get it over with to build natural immunities. We don't have natural immunities to the flu and other things. I don't know why we would to COVID, but I'll let you explain.
So when you get COVID and you get over it, it is true that you have an immune response and you have measurable antibodies. And it's also true, and we now know this from data, and there was a very well-documented episode in Brazil, in fact, where lots of people got COVID, lots of people got over it. And then later on, when a new variant came along, those people got COVID again, and there was no guarantee that they were going to have a less severe case. So we know from what we're observing and the data that's being kept track of around the world that yes, you can get another infection from COVID. So just relying on natural immunity is not enough. There's been another study that was published recently, and it involved data from the United States that showed that people who had been just recovered from COVID, relying on that natural immunity, were twice as likely to get COVID again than fully vaccinated people. So natural immunity does contribute to an immune response. It is somewhat protective for a time, but that natural immunity wears off. And we know from around the world that natural immunity is not sufficient to protect you from getting COVID again, or even for protecting you from dying of COVID.
I think at this point in the pandemic, the focus is largely on children, especially since we're in the middle of this surge as school starts up once again. And there is still that belief that, like we saw previously, children don't get as seriously ill with COVID-19. The Delta variant is changing that conversation. So what do you think people need to understand about what we know about this Delta variant and the risk to kids?
Right. So the Delta variant is just highly, highly infectious. It's as infectious as chickenpox. It's far more infectious than the earlier strains of COVID that we were dealing with, which means that it's harder to prevent people from getting it. And kids are especially vulnerable because we can't immunize the under 12-year-olds yet. And so we're seeing proportionally across the country more kids coming in with COVID and filling up pediatric hospitals and pediatric ICUs. I'm not a pediatrician, but I speak regularly to pediatric infectious disease specialists. And we have been seeing this around Texas. And, in a couple of more months, we're going to have all of the numbers for you. It is still generally true that the younger people are not going to get as severely ill as old folks and folks who have multiple comorbid conditions such as diabetes and high blood pressure and heart failure and lung disease. Kids don't have as many of those things. So it's true that their odds are better than an 80-year-old with a bunch of diseases. But the truth is that we are seeing children that are having very severe cases. And we hate to see that because we know that this is a preventable disease.
I know that we all wish we had a roadmap of where we are headed. And looking at the numbers we're seeing here lately, the positivity rate has dropped in San Antonio. Hospitalizations are down. However, still over 1,300 people hospitalized. Do those decreases to you signal that this curve is headed downward, or are we not there yet?
I was just looking at those numbers today, Myra, and it looks like we kind of peaked 3 days ago, but we haven't come down very far. That it went up, and now it's kind of hovering, and it's not coming that far down. Other things people need to know is that the hospitals are extremely full right now. The emergency rooms and our medicine beds are experiencing record numbers. So it looks like, the people that are sick from other things are coming in and getting their unmanaged diabetes and their diabetic foot ulcers and those kinds of infections and complications taken care of. So the hospitals are super, super full. It's not a good time to come to the emergency room. It's just one more reason to take that step and go ahead and get your vaccine against COVID-19 if you haven't done so already, because you don't want to have to be the one that's going into the emergency room feeling short of breath.
That's the best way to say thank you to our healthcare workers, too. Get the vaccine. Dr. Ruth Berggren, Long School of Medicine at UT Health San Antonio, as always, appreciate your time.